that very few Republicans hold. So why are they closing the government? Now, I understand that many of them don't like the health care reforms, the Affordable Care Act, a law that was passed by the House and Senate, signed by the President, upheld by the Supreme Court. It's the law of the land. Some of them don't like that. You know what? Some Americans are uncomfortable with that. They want to learn more about it. What does it mean for them? How does it help them?
Thank you, Mr. President. First, I ask that the quorum call be lifted.
Without objection.
And next, I ask for permission for various committees to meet. I have 3 unanimous consent requests for committees to meet during today's session of the Senate. They have the approval of the majority and the minority leaders. I ask unanimous consent that these requests be agreed to and that these requests be printed in the record.
Without objection.
Thank you, Mr. President. Today is a day, Mr. President, of enormous promise and needless tragedy. The promise is in the beginning, another step forward in America's progress toward providing all Americans with affordable health care. It's a welcome day because Americans can now enroll in health insurance through the Affordable Care Act. But it is also a needlessly tragic day because in the midst of a fragile economic recovery, millions of Americans are out of work now, and an extremist faction has sworn to its followers that the Affordable Care Act would never be allowed to stand, and now they have shut down the government because they did not get their way. I want to begin by talking directly to the people of Connecticut. Today is an enormously frustrating one for me because in the years, indeed decades of public service that I have sought to provide to people in Connecticut, never have I been barred, as we are today, each of us in this chamber, from serving their needs individually, from phoning them and proactively putting staff on issues that concern them. Due to the shutdown of the federal government, our office operations in both Hartford and Bridgeport are severely reduced, as well as in Washington. If a constituent needs help, if there's an emergency, if there's an issue that is time sensitive, you can reach our office and we will provide help. We will endeavor to meet any issue that concerns the health and safety and lives of the people of Connecticut. And in no way is our commitment to you diminished. I regret that our staff will be handicapped by the legal constraints. Indeed, we are, in many instances, not permitted to work in the ways that we have. But I can assure you that we are continuing to serve you. Today in Connecticut, enrollment in our health exchange will ensure access to more affordable quality health care for millions of middle-class families. Access to affordable quality health coverage is a basic right. We can't deny it. We can't turn back the clock. We need to work together, Republicans and Democrats, to improve and strengthen it and to bring down the costs of health care. The task ahead is to reform health care delivery, to bring down the rising, in fact, astronomically increasing costs of health care, and to build on the work that has already begun under the Affordable Care Act and before it. There's a real difference between an America with affordable health care and one that lacks it. It's an America where a woman is no longer a pre-existing condition. Being a woman is no longer a pre-existing condition, where a family that is responsible and pays for health insurance knows that when they arrive at the delivery room, they will not be bankrupted by by the bill, and where children are not denied care because they happen to get sick. We are at an impasse here in Washington because of a matter of principle. The kind of hostage-taking that we see here cannot be allowed to take place. It has no legitimate role in a spending bill. The bill before us would enable government to continue the people's work, to continue to do business for the American people. That's our job. And the effort is to attach to that resolution a completely unrelated demand that the Affordable Care Act be defunded or delayed or destroyed. To tie health care repeal to a funding bill is like tying immigration reform to the National Defense Authorization Act. It is a dangerous precedent. It cannot be permitted. And if we accept this take-it-or-leave-it approach that led to this shutdown, we will be forced to govern this way or fail to govern this way in the future. In fact, the resolution before us already involves compromises. Less money than is necessary, for example, to rebuild our roads and bridges, to engage in infrastructure, repair, and rebuilding. Rather than nation building abroad, more nation building here at home has to be done, and more investment is required. The compromises in this funding bill have been made in the amounts of money included in it. The impacts of this shutdown will be felt throughout our economy in all 50 states, thousands of jobs in Connecticut if the shutdown continues for weeks or months, and there are millions of families nationally and thousands in Connecticut that will go without paychecks. 9,000 federal employees in Connecticut will be affected. Their work is important, but the ripple effect is equally important. The losses of income and diminished consumer demand that will further inhibit economic growth. The defense contractors who will lose their contracts or possibly fail to receive checks when they need them. A shutdown does nothing to address our need to agree on a responsible budget and replace the slash and burn across the board sequestration cuts that are continued in this resolution. And a shutdown undermines one of the key engines of economic growth in this country, research and innovation, like the research done at the Coast Guard's Research and Development Center in New London, Connecticut. What if the studies in that facility led to better ways to secure our borders, to rescue people lost at sea? Who knows what future innovations will be sacrificed there, at the National Institutes of Health, across the country, and in companies around Connecticut. The lifeblood of our economy, job creation, research and innovation, investment in the future, is undercut and undermined by this shutdown. In fact, even as we go through this process here in Washington, the Northeast region is seeking to recover from a shutdown in train service that occurred just days ago. That shutdown has been remedied to some extent, an inadequate degree, so that half or slightly more of the service has been restored. The failures in the feeder cable that led to this shutdown are directly due to a failure of investment in infrastructure, just as the derailment and collision that were caused months ago reflected a failure to invest in infrastructure. Right before our eyes, as we engage in this kind of conduct here in Washington that led to a shutdown, are the consequences of investment failure in our roads and bridges and train system. With displaced workers struggling to get back into the labor market and businesses in need of specific skills, it is shocking that we should cut back first on job training through these unresolved sequester cuts that are projected to force Connecticut's job training services to assist 9,360 job seekers than they otherwise would. We need to come together now, and the message to Speaker Boehner has to be, let the House vote. There are reasonable minds on both sides of the aisle that say, let's have a simple, straightforward spending bill without these unrelated demands, without the blackmail and hostage-taking tactics. Let us come together on that kind of simple, straightforward way of continuing the people's business and the government's work for the people. Many of my colleagues, and I listened with great interest to the senator from Alaska and others on the other side of the aisle, saying that we should let common sense and calmer minds prevail and deal with the issues relating to the Affordable Care Act or immigration separately and distinctly. They are measures that deserve and need attention, and there are ways to strengthen and improve many of our laws. But let's deal with them on their merits, not as demands or conditions for continuing the people's work by their government. I truly believe that as we look back on this day, it will be with pride in another step forward for health care reform in this country. A lot of work remains to be done. Bringing down the cost of health care is a task, an unmet challenge that needs to be addressed, as well as other ways to strengthen and improve our health care system and the law itself. Let the House vote on a measure that provides simple, straightforward funding to continue the work of government for its people and allows the economy to continue its recovery and growth, that allows job creators to do their work, and that allows our working families, middle-class families, to have the benefits of education and Social Security and veterans benefits that they vitally need. These essential functions must continue. Let the House vote. Let reason prevail. And we can return to the work that government should be doing for its people. Thank you, Madam President, and I yield the floor.
Madam President.
Senator from South Dakota.
Madam President, I think that the American public overwhelmingly opposes Obamacare. Every survey shows that. All of us hear it when we're traveling back in our states. They also support keeping the government open. And we have had an opportunity over the course of the last several days to deal with both of those issues. In fact, in order to avoid a government shutdown, you have to have people who are willing to work together and come to a solution. Now, the House of Representatives has not once, not twice, but 3 times sent to the Senate proposals that would fund the government and that would make some changes to Obamacare that would provide the same sort of relief to every American that big businesses have received from the President by virtue of some of his waivers and exemptions. And on all 3 occasions, that was turned down, tabled when it got here to the United States Senate. And so what did the House of Representatives do? Well, their most recent proposal advanced to the Senate was to allow the House and the Senate to appoint conferees to a conference committee where senators and House members might be able to sit down, Democrats and Republicans, and actually hammer out some sort of a solution to the challenge that we face in front of us. Well, that got tabled this morning, and that's the first time I've ever seen that happen here in my time in the Congress, where, and maybe the first time that it's ever happened, where one body has asked for a conference and asked for appointing of conferees, and it was tabled, not just turned down and said, no, we're not going to do it now, we'll do it another time, but actually tabled a motion, a tabling motion to a request from the House of Representatives to have a conference on how to work out the situation in a way that would allow us to keep the government open and hopefully provide middle-class Americans some relief, and the economy and taxpayers and employers across this country some relief from Obamacare. And so we are where we are now, where we have the House of Representatives having suggested to the Senate that we sit down together in a conference committee and work out our differences, the Senate having rejected that. Now, we could all argue about how we got where we are initially. I think it all starts when we don't do things the way that they're intended to be done around here. In other words, taking the appropriations process, moving those bills forward. We had here in the United States Senate an opportunity, like we do every year, to move the individual appropriation bills. There are 12 separate appropriation bills that historically have been the way in which we have funded the government. Well, this year we didn't move a single appropriation bill through the United States Senate. The House of Representatives moved 4 of the bills through the process. Didn't get through all of them, but at least they got some of the appropriation bills completed. But here in the United States Senate, we didn't move a single appropriation bill. And so what happens is, and we all see this coming, it's not like it's any secret or any surprise, there's a calendar, and then when that calendar and those deadlines aren't met, you get up against the end of the fiscal year like we are right now, and you have this huge push to try and keep the government from shutting down, and we generally do it in the form of a continuing resolution. But the fact of the matter is, if the Senate had done any of its work earlier this year, if we had taken up any of the appropriation bills and passed them, we wouldn't be at the crisis moment that we have in front of us now. Now, why is it that so many Republicans in both the House and Senate, and I would dare say Democrats as well, although they haven't demonstrated it with their votes, are concerned about what's happening with Obamacare? Well, obviously, as the more information becomes available about Obamacare, the more concerns, the more frustrations, the more questions the American people have. And in fact, I've mentioned this previously, but in my state of South Dakota, according to the report that was put out last week by the Health and Human Services Department, if you compare the premiums that a 30-year-old male and a 30-year-old female would pay in the state of South Dakota for a bronze plan in the exchanges, the increase in premium for people in that age category would be, if you're a man, 393%, if you're a woman, 223%. So for a 30-year-old female in the state of South Dakota, the annual increase in insurance premiums would be $1,500. If you're a male in the state of South Dakota, the annual increase would be $2,000. So there's a real concern about the impact that this will have as these exchanges get up and running on what people are currently paying for health care coverage. There's also a lot of evidence and data out there now that suggests that it doesn't apply just to a 30-year-old male or female in my state of South Dakota. It also applies to families. There are many families across this country, obviously, who are concerned about how this is going to impact the cost of health insurance for them. And if you look at what health insurance costs have done for families, since the President took office, they've gone up on average about $3,000. Since Obamacare passed, those premiums have gone up for families by about $2,500. And so you've seen premiums going up already. You've got a lot of concerns as these exchanges get up and running starting today about what impact they will have on premiums for middle-class Americans. And so that's why there's a lot of concern and anxiety across the country today with regard to the impacts of Obamacare. You also have a lot of concerns about how this will impact jobs in the economy. We've already seen that many of the jobs created, a majority of the jobs created this year, are part-time jobs. And there are many reasons for that, but if you talk to employers, one of the things that they'll point out is that the requirements in the new health care law are that if you have 50 or more employees, you have to offer government-approved health care or pay a penalty. So a lot of employers are trying to stay under that 50-employee minimum or threshold so they don't have to face that requirement. And so what happens? Well, they either hire people or they don't hire people they were otherwise going to hire, or they look at ways to reduce their workforce. Well, it applies in another way because the definition of full-time employee in the law is 30 hours per week. And so what many employers are doing, again, they'll be subject to the same sorts of penalties. So what many employers are doing is instead of hiring full-time workers, they're hiring part-time workers, 29-hour-a-week workers. Obviously, 29 hours a week doesn't give you the kind of pay that would allow you to meet the needs that your family has. And so more and more people are working two jobs, and you see the impact, the distortion that this new law is creating in the workplace and for a lot of employers. So there was lots of anxiety and angst about that, which was voiced, I think, to the President, to his administration. And so what did the President do? Well, the President decided to delay the employer mandate in the law for a year. So I think employers took great comfort, at least in knowing that's not going to be there for this year, but they're also still very worried about what happens when it does kick in the following year. But you also have all these employers, and people said, well, who are they? Who are these people? I don't know how you can travel your state or travel anywhere else outside your state and not hear from employers who are expressing the concerns, asking the questions about what this is going to mean for them, and expressing grave reservations about the impact that it's going to have on their ability to create jobs. And so as you talk to these various employers, you get lots of anecdotal evidence. I mentioned last week there was an interview done with an employer in my state of South Dakota where that person was asked about how this would impact them, and they said, well, I guess we just won't, we're probably not going to hire as many people as we otherwise would hire. And he said, I think that's going to be happening in businesses all across the country. That's one example from my state of South Dakota. But if you look at the sort of the aggregate, according to Investors Business Daily, there are some 300 businesses who have said that they are going to reduce the size of their workforce or not hire people that they otherwise might hire as a result of the impact of Obamacare. And so you see more and more of the experience, the evidence that we just get from day to day talking to employers in our individual states, but you also start seeing this cumulative effect and more businesses expressing those concerns. And when you look at the economy today and where we are, you find out very quickly that the unemployment rate, which has been at north of 7%, 7.5% for a long time now, when you actually back out, or I should add back into that equation, the number of people who have either stopped looking for work or are working part-time where they would rather be working full-time, the actual number is much higher. You have about 22 million Americans, and the unemployment rate climbs quickly into the double-digit territory when you add those people back in. And the labor participation rate, which is the number of people in the workforce relative to the number of people that could be, is at the lowest level literally in 35 years. So you have a historically low labor participation rate, fewer people actually looking for work, some just flat having given up on it. You have a very soft economy. I don't think anybody would describe the economy today as being robust. You have a chronically high unemployment rate. You have the jobs that are being created being part-time jobs, and so you have the overall average household income in this country actually going down. In fact, if you look at the statistics since the President took office, the average household income has gone down by about $3,700 per family. $3,700 less income for the average household, $3,000 higher in health care costs. You can see how middle-class families are getting increasingly squeezed by what's happening out there as a result of Obamacare. And so what was being proposed, at least one of the suggestions that came over from the House of Representatives, one of the more recent ones at least, was last evening. And it came back with a funding resolution to fund the government and a couple of provisions that dealt with some of these more onerous provisions in the Obamacare law. One had to do with the individual mandate. And the whole theory behind giving people relief from that is to give them the same treatment, to be fair, that employers get. If the president has chosen to waive the employer mandate for big businesses, which he has for a year, why do you then require individuals to have insurance? Now, there's going to be a significant cost associated when everybody has to buy insurance. It's about a $12 billion cost to people across this country. And the question is then, if you're going to give the relief, if you're going to give the temporary relief to the business community, why then would you not, in a fair way at least, make sure that individuals are treated the same way? And that seemed to be a pretty compelling argument. And if you're going to do something that actually does impact in a favorable way people across this country who are suffering, are going to be suffering even more so from the harmful effects of Obamacare, it would strike us at least as a reasonable thing to suggest that you give a year delay, if you will, to people under the individual mandate, the same delay the president has given big businesses under the employer mandate. The other provision that was attached to the continuing resolution proposal that was advanced by the House last night had to do with treating members of Congress and their staffs and people here in Washington, D.C. the same as everybody else. And it strikes me again at least that if we're going to have these policies, that everybody ought to be treated the same way. Now, frankly, Madam President, my hope would be that we could relieve everybody from this. I would love to see us permanently delay this so that no American would be subject to the harmful impacts and effects of Obamacare. But for sure, for certain, people here in Washington, D.C. should not be exempt. There should not be a separate carve-out or a separate treatment for people here in Washington, D.C. Compared to other people around the country. And so the legislation that came over from the House last night included a one-year delay in the individual mandate, trying to treat individuals as fairly, treat people across this country in the same way that businesses are being treated in terms of the way that the law is being applied. And secondly, to make sure that people here in Washington, D.C., members of Congress and their staffs and others, are treated the same way as everybody else around the country. In other words, there's no exemption, there's no carve-out, there's no preferential treatment for people here in Washington, D.C. Those were the two things that were attached to the funding resolution last night. That got tabled here in the United States Senate. And so, having sent now 3 different proposals over, the House of Representatives has, I think, decided, okay, clearly the Senate doesn't like any of our ideas. Let's get together and have a conference committee. And so that was proposed. And again, something I've never seen done before, a motion to table a request to go to conference. Now, we had lots of requests to go to conference. Sometimes those are not adhered to, and you have a debate about various conference meetings on various pieces of legislation that we deal with here in Congress. But I've never seen a tabling motion on a request to go to conference. Pretty clear indication that the United States Senate has no interest in resolving this matter. Otherwise, they would at least sit down with our counterparts in the House of Representatives and say, what can we do to find that middle ground? What can we do to find that consensus? How can we resolve the differences that we have here in a way that will keep the government up and functioning and hopefully provide some relief for people who are struggling under the impacts of Obamacare. So that's where we are today. And what's interesting about it is our colleagues on the other side, the Democrats, all of whom, not all of whom because they weren't all here at the time, but those who were, all voted in favor of Obamacare. There isn't a single Republican here at the time who did, nor are there any here today who would. And in fact, every time we've had an opportunity to vote to repeal all or parts of it, everybody on this side of the aisle has voted for that. But our colleagues on the other side continually to hold out this argument that, well, after all, this is the law of the land. And frankly, they're right. It is the law of the land. But it's pretty obvious that, at least in the President's view, there are parts of the law that don't need to be applied right away. Otherwise, he wouldn't have extended a one-year delay or a one-year waiver under the employer mandate. So it's pretty clear that the President has a different view of this than perhaps his allies here in the United States Senate with regard to what that law actually means. He's been perfectly willing on not just that occasion, but other occasions, to take portions of the law and not apply them, to waive them, to provide exemptions for particular groups of people, namely those here, as I said, on Capitol Hill, and also big businesses around the country. And so there's a very discriminate way in which the President is approaching this law, and it seems to me, again at least, that in fairness you would give the same treatment, favorable treatment to individuals that you've given to big businesses. The other thing that's really interesting about our folks on the other side of the aisle saying that this is the law of the land. There are many things that are the law of the land. The Budget Act is the law of the land. The Budget Act, which was passed back in the 1970s. I want to say 1973 or 1974. It's the budget law that Congress has been under now for the past almost 40 years, about 40 years. And yet for 3 consecutive years in a row, the Democrat majority didn't even pass a budget. Didn't move it through the committee, didn't bring it to the floor, just said we don't need to do it, we'll just ignore the law. That happened for 3 years in a row. So I would suggest, Madam President, that our colleagues on the other side who are quick to say that Obamacare is the law of the land are very willing, when it serves their purposes or they find it convenient, to completely ignore other laws that have been on the books for a much longer period of time. And so that argument to me is really sort of misses the point. I guess what I would say, Madam President, is that I hope this can be resolved. It needs to be resolved. I think we need to provide some relief for the American people from the impacts of Obamacare. Clearly, our economy needs a break. The American workers, middle-class families need a break. Employers have already been given a break. As I said, big businesses by the President have been given a 1-year delay under the law. Why not apply that to others who are going to be hurt in an equal fashion? And just to put a fine point on why it's important, we think, to have some delays, today is the day when they roll out the exchanges. But I got to tell you, if you look at what the reports are about whether or not those things are ready, up and ready to go, it's pretty clear they're not ready for prime time. We hear about glitches, which is the President's word. I think that's kind of a kind word. Malfunctions, inaccuracies, bumps in the road. We've heard them described all those different ways, but the clear reality is that this thing is not ready for prime time. And so why would we not delay it? In fact, there was a story yesterday in the Wall Street Journal, and the headline was, "Late Snags on Eve of Health Rollout. Nonprofit groups," and this is quoting, "nonprofit groups and brokers that will help enroll consumers in the exchanges say they haven't yet had a chance to preview the systems. Technical problems have limited certification for some nonprofit workers involved, and some of these groups say they haven't fully staffed up for the influx. The exchange software that determines whether people get subsidies was returning accurate determinations about 2/3 of the time late Friday, up from less than 50% earlier in the week, so at least they're trending in the right direction. Yesterday, eHealth Insurance, one of the several online web brokers that signed agreements with CMS to sell federal exchange health plans, announced that it won't be able to offer those plans on October the 1st, blaming CMS delays." Madam President, the point very simply is that this is clearly not ready for prime time. Last week, the District of Columbia Exchange said that they're experiencing a very high error rate, very high error rate. Error rates, malfunctions, inaccuracies, bumps, glitches, this all seems to me to suggest that this is something that needs to be delayed, and I think that that would make the most sense given the fact that the President has already acknowledged that for big businesses, for employers, it ought to be delayed for a year. I think there's bipartisan support for giving individuals and families relief, just like businesses have been granted. We have a Democrat senator, our colleague from West Virginia, said last week that delay for individuals would be a very reasonable and sensible thing. But this week, Senate Democrats voted in lockstep with the President and refused to give low-income and middle-class families that same relief that's been provided to big businesses and some of the President's allies. So we're sitting here right now kind of in a holding pattern, but it seems to me at least that the ball is in the Senate Majority Leader's court. The House of Representatives has asked for a conference, been rejected, said we're not going to sit down, we're not going to negotiate this. The President has said we're not going to negotiate. We are not going to sit down. We don't believe there's any room here for negotiation. And I would say, Madam President, that I think the American people are going to perceive that to be an unreasonable position. Because I think that most people understand that when we come here, we have differences of opinion, but the way that you resolve those is you sit down and work out those differences. You try to come to some resolution that would allow everybody to move forward. And what we have seen here, at least, is time after time now, the House of Representatives has sent to the Senate proposals. The Senate has, those have been tabled here, and the House has sent back another one. I said 3 times now that's happened. Finally, the House of Representatives said, okay, we get it. You don't like what we're sending you. Let's sit down and see if we can work this out. Let's have a conference and see if we can work out our differences. And that was tabled by the majority leader earlier today. What's coming out of the White House, what's coming out of the Democrat majority is, sorry, we don't negotiate. We are not going to sit down. We are not going to try and find common ground. We are not going to try and find a bipartisan solution to this. We're going to have it our way, and you can take it or leave it. I don't think that's what the American people sent us here to do. I think they sent us here to do the people's business. Like I said before, and I started my remarks, I believe the American people overwhelmingly dislike Obamacare and the effects it's having. I think they also overwhelmingly believe the government should stay open. And I think we can accomplish both of those objectives, hopefully sooner rather than later, if both sides will sit down in good faith and actually try and work out a solution. But that's certainly not going to happen as long as the President continues to stay dug in. This is at least, appears to be at least, he's drawn a line in the sand. And that seems to be the tack and the approach that's being taken by the Senate majority here, by the Democrat leader. That's not going to get us to an answer. That's not going to get us to a solution. All that's going to do is provide even more frustration, even greater disdain and cynicism from the American people when they see the infighting that's going on here and a lack of a willingness on the part of the Democrat majority to sit down with House Republicans and figure out what is in the best interest of the American people as we move forward. Madam President, I hope we can do better. The American people deserve better, and future generations deserve better from us. I yield the floor.
Madam President.
Senator from Tennessee.
Madam President, I ask consent to speak as if in morning business.
Without objection.
Madam President, this government shutdown is disappointing to me. It's disappointing to those who are affected by it, and I'm sure it's disappointing to the American people because they're seeing their government not function in such a visible way. What is especially disappointing to me is the unwillingness of the President and Senate Democrats to make a reasonable effort to resolve the real differences of opinion that exist here. It's not unusual, Madam President, that we have differences of opinion in Washington, D.C. In fact, the founders created a government here with the expectation that it would kick up to the nation's capital the disputes we couldn't resolve in our own families, the disputes we couldn't resolve in our city councils and county commissions, in our state legislatures and state government. And the founders intended that those disputes, which are in this body, not be resolved easily by creating a system of checks and balances, a Supreme Court, a presidency, a Congress, and by creating in this body rules that make it very difficult to come to a result. The idea was we didn't want a king. A king is efficient. Tyranny is efficient. Our founders didn't want that. They didn't want a despot. They wanted a way to get eventually to a result. They sought to avoid the tyranny of the majority by creating these checks and balances and these rules in the Senate. They sought to create a situation where the majority couldn't ride roughshod over the minority. But I don't think the founders envisioned a system of checks and balances that produced a permanent stalemate on issues that are important to the American people. Even in the most contentious of issues, and there have been many issues in our history, much more contentious than anything we're dealing with today, they didn't envision that the government would simply shut down or stop operating or stop trying to come to a result. That is why I find the attitude of the President and the Senate Democrats so disappointing. By any fair measure. The proposals by the Republican House of Representatives to bring this to a solution are reasonable proposals. Let's look at what they proposed. They propose that we continue funding the government. Every single proposal that the House Republicans have made to this body is that we continue funding the government. And they propose that we also, at the same time, number one, be fair to the middle class by delaying the individual mandate in the new health care law for a year. Now, the President's already himself delayed 7 major provisions in the new health care law that's supposed to take effect today. These include the employer mandate, which is $12 billion over 10 years for corporations. Yet the President and Senate Democrats are saying we can give the employers a $12 billion break by a 1-year delay, but we're going to stick it to the middle class of America by fining them $95 if they don't buy health care and sending the IRS out to collect it next year if they fail to do it. What we suggested was, since the President himself has already delayed 7 major programs, since the regulations aren't written, let's also delay the individual mandate for a year. That would be fair to the middle class. Number 2, the House has suggested that we continue funding the government and be fair to those who are ill by repealing the medical devices tax. 79 senators have voted for the medical device tax repeal, including a large number of Democratic senators. Number 3, the House Republicans have said let's continue the government and be fair to the American people when it comes to health care. Treat the American people the same way Congress is treated. And finally, most recently, the House Republicans have said let's continue to fund the government, and can we not just sit down and talk about it in a conference, which is the way under our rules established by the Constitution we're always supposed to resolve disputes. And so the answer has been no. No in fairness to the middle class by giving the same consideration to the middle-income person who's required to buy health insurance, fairness to those who are ill by repealing the medical device tax, fairness to the American people by treating them the same way Congress is treated, and then just fairness to the system by saying, can we not just sit down and talk according to a conference which is provided by our rules to resolve disputes? And the answer by the President and by the Senate Democrats is no, no, no. The President's role is to bring us together. He said that in his campaigns. He has a great capacity for persuading the American people he's right. He seems to be able to talk with the Iranian rulers but not with the Republican leaders about a process that is leading to a virtually unprecedented shutdown of the American government. Our goal is fairness for the middle class, fairness for the taxpayer. Our latest offer from the House Republicans was, let's keep the government running and let's sit down according to our rules and have a conference and talk about it. This stubbornness in the face of reasonableness will not be good for our country. It will not be good for either political party. It will not help us to achieve the kind of result on this and other issues that the founders intended by creating a system of checks and balances in our democratic form of government. I thank the President. I yield the floor.
Madam President,
Senator from Maryland.
I would ask consent that I be able to speak for up to 10 minutes as if in morning business.
Without objection.
To the Majority Leader.
The Majority Leader.
The Speaker of the United States House of Representatives holds the key to reopen the federal government. It's an easy key to use. In fact, it's very simple. The key is to allow 435 members of the House of Representatives to vote to reopen the government. And do it now. It's not too late to avert the worst economic problems that this shutdown relate to. But you see, Madam President, I'm not the only one calling for the Speaker to open the government. I'm not the only one calling on him to do the right thing. This is what Republican Congressman Scott Riggle from Virginia said. He said it this morning, and it's a direct quote. "We fought the good fight. It's time for a clean CR." That's a Republican congressman. If the House votes to reopen the government, Democrats will gladly go to conference. Unfortunately, I read that Speaker Boehner and House Republicans are engaging in silly, empty political stunts instead. What he's going to do is have some Republicans, members of Congress, sit down for a photo op across from empty chairs. Now that's really so unique. Has it ever been done before? Maybe only 5,000 to 6,000 times since I've been in Washington. What they're really sitting down to instead of empty chairs is an empty stunt. So I say to House Republicans, the time for photo ops and these silly stunts should end. Shutting down the government isn't kid stuff. That's kid stuff. Shutting down the government is deadly serious. The business community has warned of the grave economic consequences of the shutdown. It's now being proven. For every day the Speaker refuses to use the key to reopen government, the American economy is being cost billions of dollars every day. The solution is as clear this morning as it was last night. Reopen the government. You hold the key to putting millions of public servants back to work. Now, once that happens, Madam President, we're happy to go to conference, but only if the government is reopened. I would ask now unanimous consent that following the remarks of Senator Cardin, for up to 10 minutes, Senate recess is provided under the previous order.
Without objection.
Madam President.
Senator from Maryland.
Madam President, I see my colleague from Tennessee just left the floor, and I was listening to his comments, and I know he's having a hard time, as many of our Senate colleagues in the Senate, understanding or justifying the actions of the Republicans in the House. Make no mistake about it. This is a House Republican shutdown of government. That the Majority Leader was talking about the consequences. The House Republicans have tried to hold all of us hostage. It's not going to work. When you talk about negotiating, the Majority Leader is absolutely right. We have tried on numerous occasions to get to a conference on the budget, only to find objections from the Republicans to sit around a table to talk about the budget of the country. So we're not going to yield to extreme measures. We should have government open, and then we should be negotiating the issues that are important. I take this time to talk about our federal workforce and to talk about the impact that this shutdown will have on federal workers, on the people of Maryland, people of our nation. I'm proud to represent Maryland in the United States Senate. Federal workers, once again, are going to be asked to take sacrifices on behalf of their country, but this time they don't understand it. This shutdown will have a negative impact on them and on our country. For 3 years, federal workers have been working without a pay increase, about an adjustment of salary. I had my staff check some of the statistics on the number of federal workers we have today compared to the historic numbers. In the 1950s, we had we actually have fewer workers per capita today than we did in the 50s. We are asking our federal workforce to do more with less. And we're asking them to continue to work under sequestration when many have been furloughed. And now our federal workforce have been furloughed in great numbers, uncertain as to whether they will receive a paycheck. And then there are federal workers who are working today, and they don't know when they're going to get their paychecks. It's wrong, and it's going to hurt families. And they're going to have to try to figure out how they're going to pay their bills without getting a paycheck. But it goes well beyond the federal workers themselves. Look what the reductions we see in the federal workforce here in the Washington area. What do you think are happening to the retail establishments, the small businesses? What's happening to our economy? We've estimated in Maryland that we lose $15 million a day for every day the federal government is closed. Mark Zandi said that the impact of a federal shutdown will increase the unemployment rate by 0.5%. In the 1995-96, when we had a shutdown last, OMB estimated it cost the taxpayers $1.4 billion. This is wasting taxpayers' money. It's putting people under incredible stress as to how they're going to pay their bills. For what? To move an extreme agenda? To try to see whether hostage-taking works in the United States Congress? This will have a major negative impact on our economy. And the private sector recently has created 7.5 million jobs over the last 42 months. There are more people on private non-farm payrolls than any time since September 2008. Jobless claims are close to a 5-year low. The second quarter of 2013 marked 9 consecutive quarters of economic growth, the longest stretch since before 2008. And now, because of the House Republican shutdown, we want to reverse that? We want to go back to a failing economy? That's what's at stake here. When it costs our taxpayers money, the inconvenience that we're causing the people of this country by government shutdown. I could talk about life-threatening delays, the researchers at NIH being compromised, the inability of NIH to take on new patients as a result of the shutdown. Absolutely affects the welfare of the people of our country. Small businesses unable to get SBA loans. How do they run their business during the shutdown? In my state of Maryland, and I know this is true around the country, the backlog on veterans getting their disability claims heard is tremendous. That will now grow as a result of this government shutdown. The FDA is responsible for food safety. I could talk about a lot of different agencies. Let me just give you the numbers on the FDA. 45% of the FDA's workforce, or 6,620 employees, will be furloughed. The FDA will be unable to support the majority of its food safety, nutrition, and cosmetic activities. The FDA will also have to cease safety activities such as routine establishment, inspections, some compliance and enforcement activities, monitoring imports, notification programs, etc. That's what this shutdown will cause. We want to make sure we have a safe food supply. Well, today, it's not quite as clear as it was yesterday. Yeah, we know about the national parks being closed and the zoo. That makes no sense at all. People being inconvenienced, but people's health will be put in jeopardy because of this House Republican shutdown. It is totally illogical. We've tried to go to conference on the budget. There's 3 problems we have before we get a workable budget for this fiscal year. First, we've got to keep government open. Second, we've got to make sure we pay our bills. And third, we've got to get rid of sequestration. That's what we've got to get done. And yes, we've got to sit down, Democrats and Republicans, and work out a budget for this fiscal year. But you can't do it while government's closed. When you fail to pass a budget, and quite frankly, it's the Republicans who have been unwilling to sit at a table to come up with a budget, when you fail to do that, the regular order is to pass a continuing resolution that continues the budget, the government operating until you reach a budget. And we've always done that at the current level. Well, the Democrats are willing to go even further. We're willing to take the Republicans' reduced budget number because of sequestration. And that they can't even accept. Because, quite frankly, there are too many on the other side of the aisle in the House that want a government shutdown. That's not the way we should be operating. I'm proud to represent so many federal workers. I'm proud to represent the people of Maryland. And I tell you, we're going to continue to fight on behalf of the right policies. We're going to fight to make sure that federal workers are held whole when this is over, that they're able to get their paychecks with full pay. It's going to be a struggle because of the attitude, particularly on the Republicans on the House. But we're going to continue to fight for what's right for our federal workforce and for the American people. Let us pass a resolution to keep government open. Let us sit down and work out a budget for this coming year. Let's do what's right for the American people. With that, Madam President, I would yield the floor.
Under the previous order, the Senate stands in recess until 2:15 p.m.
As the government shutdown continues, Senate lawmakers are now taking a break to attend weekly party caucus meetings. Earlier, the Senate rejected a House proposal to go to conference to negotiate the differences between the two bodies in regard to government funding and the health care law. That was a 54-46 straight party line vote. The Senate will be back at 2:15 Eastern. We'll have more live Senate coverage for you then here on C-SPAN 2.